Good evening, everyone. I think it's time to start. Gaurang, are you ready for the lounge? Can you hear me? Yes, okay. So I will first shortly introduce myself. My name is Judith Staats. I'm a homeopath and a teacher in the Netherlands. And as a representative of the Academy for Classical Homeopathy, I can say that we are proud of collaboration with Dr. Gaurang Gaikwad, because this free webinar serves as a warming up, an introduction to the upcoming seminar that we organize together in the Netherlands. This seminar is taking place on the 14th and 15th of November and can be attended online and on location as well. I will share the link for more information in the chat. I want to notice that if you're having trouble with registration for the seminar, please email us. We will be happy to assist, because the website is partly written in Dutch and therefore may be a bit confusing for some. So during this 2-day seminar in November, Dr. Gaurang will intensively train us in the use of sarcodes, nosodes, and bowel nosodes, in which he has massive experience. The remedies that will be discussed in the light of pediatric cases and hormonal and metabolic disorders are pituary gland, thyroidinum, growth hormone, cortisone, DNA, RNA, pancreatinum, and pepsinum. And he is also quite specific about which potency to use. So then we are going to be guided along this process through an extensive number of cases in today's diseases. I'm really looking forward to this in-depth knowledge about the sarcodes, nosodes, and bowel nosodes. So we're very pleased to have you here tonight, Doctor. And yeah, although your basis lies in India, where homeopathy is widely used and accepted, you are a worldwide popular clinician, author, and teacher. And tonight we will focus on the remedy pituary gland. Dr. Gaikwad will lead us through this matter, and there will also be space for questioning. So if you have any questions, please describe this in the chat fully, as we can relate this to the subject. So may I now have your attention for Dr. Gaurang Gaikwad. Oh, one last note, please everyone make sure to mute yourself so we can hear Dr. Gaurang properly. Thank you.
Thank you, Judith, and good evening, everyone. It's rather late for us in India, but I'm happy to meet all of you. So as Judith has shared the topic for today, is just an introduction to some interesting remedies for today's times. Sarcodes. Enzymes, hormones, organs. So I think most of our participants who have joined here already know by now that sarcodes are remedies prepared from healthy living tissues. I hope all of you can hear me and see me, and technically everything is okay. Yes, perfect. And for many years in homeopathy, we have had very important sarcodes, starting from thyroidinum, folliculinum. The great Burnett introduced remedies like uforinum and so on. Interestingly, if one really wants to study the sarcodes in detail. You can actually divide sarcodes in different categories. Some sarcodes are hormones like estrogen, like testosterone, like growth hormone, pepsinum. These are all hormone remedies. Then there are certain sarcodes which are actually prepared directly from the organs. For example, pituitary gland. For example, testes. And these are from human. On the other hand, there are certain sarcodes which are actually prepared from the animals. For example, thyroidinum is prepared from the sheep of uh, uh, the thyroid of the sheep. Very interesting. And mainly I use sarcodes in two different ways. More often, I use it as an intercurrent remedy. You can see here, there are two main ways. One way is to use it as an intercurrent remedy, especially in cases which are blocked. So you're treating a case, it's not improving, and you analyze the case. And then you feel that, okay, you need to probably give either a sarcode or a nosor to open the block and then give the deeper remedy. So this is one type of approach that you will do in some cases. On the other hand, the other type of cases are cases where the sarcode actually could be the deeper remedy. Just today was a very interesting case of a young girl about, I think about 5, 6 year old, was a case of a developmental delay, ADHD, attention deficit disorder. And she was improving so well on thyroidinum. I gave her thyroidinum based on her entire patterns and also studying her mother's state during pregnancy. So sometimes the remedy, a sarcode, of course, we have very less information in olden times about these sarcode remedies, but what me and my colleagues have been able to put together is the materia medica of sarcode for today's times, connecting the old and the new, and that makes our approach much more broader and well, more effective. So I think the best is to study from the cases. As I understand, there are many new people joined today compared to our last talk that I think we had a few months back. It's very important to know when to use sarcodes. Not in every case you're going to use sarcodes or nose, right? So what are the situations where you can use a sarcode? Number one, when there is a lack of reaction. You're treating a case, it's just not improving. So you might need to give this particular sarcode to stimulate that particular organ, enzyme, that area, that sphere. For example, in a case of impotency with certain sexual disorder in a man, he's not improving at all. You know, his sexual issues are not improving. In many such cases, you might want to prescribe the remedy testes. It's the remedy actually prepared from the testes. Alexander Blackwood has written about this in his Materia Medica. The next type of case would often be a type of case for sarcodes where one of the deep themes of sarcodes are that they are very, very fast paced. Their mind is very, very fast. They are very, very restless, very, very active. And there is a state of constant overactivity. You know, imagine thinking about a remedy like histaminum. Histaminum is a sarcode. where they just can't wait, right? You know this famous symptom of histamine. I had a case many years back where this particular gentleman just couldn't wait outside my clinic. He would be kept on walking outside the clinic because he couldn't sit in one place, you know. So I gave him, this is many years back, I gave him histamine. You can see this nice rubric. I hope you can see my screen and can see the repertory sheet. You can just say a yes, so I know that you can see it. Yes. So can you see this rubric? Restlessness during waiting, single remedy. This is a key symptom of histamine, right? So you understand how restless, how overactive, how fast-paced these Sarcode remedies are. And that's why many of the Sarcode remedies are fantastic for today's times. Yeah. Why are they amazing? Because this is our world. Our world is this. Everyone wants everything very fast. Everyone wants to do things very fast. Everyone wants knowledge very fast. Everyone wants to learn homeopathy quickly. Everyone's minds is very, very overactive, constantly thinking. And that's why Sarcodes are very important remedy also for autistic and hyperactive children. Many hyperactive children, they require remedy prepared from cortisone, dopamine. You know, there are many newer remedies now in Sarcode group of remedies. Of course, we will discuss them in so much detail. The other type of cases where I often use Sarcode is often as a tautopathy, which means that especially in cases where there's a history of lot of steroids taken, right? If you see a patient who has taken a lot of steroids, you'd want to think about giving cortisone, for example, as a remedy in homeopathic potency. So this is one of the things. So maybe it's a good time to start with the case. I want to take you to the first time many years back when I used this particular remedy. This is 7-8 years back. I didn't know that time that I would be working so much in detail about Sarcode. So let's start. So this is a case I saw many years back. This is a case of a coma. A patient was admitted in the hospital and his family member called me up and said there is a big head injury for this gentleman. You can see this particular patient, he was admitted in the hospital. And what happened was that there was a road traffic injury, then stroke, no response. And he was just not responding to anything at all. And they asked me what remedy should I give. And I really didn't know what remedy to give because the family had already given everything, you know, arnica, natrum sulph, and this particular gentleman was admitted in the hospital. Yeah. And they just sent me some pictures and they said, can we do something? He's not reacting. He's not responding. There is a big head injury. Can you do something? Can homeopathy do something when arnica fails because there's a big head injury? So this was a few years back when for the first time I started studying out of box remedies because I realized that very often well-known indicated remedies are not helping, like arnica. Now, what to do? It's not helping. Arnica is the best remedy for head injury. It goes without saying. I am not going to tell you how important arnica is for a head injury or how important natrum sulphuricum is for a head injury, but it's not helping. So now we have to think out of box. And that's when I started studying. And when I started studying literature from the past, I found that there are certain sarcodes which are very important remedies as out of box remedies when well selected remedy fails. And that's when, for the first time, I gave the remedy Pituitary gland. Pituitary gland, the whole. It's a remarkable remedy, this. And hopefully we'll get a very good picture today. So I gave pituitary gland. Why did I give pituitary gland? I think that's important for us to know here. Pituitary gland. We have a remedy, pituitary gland. Pituitary gland. It's a remedy established in 1935, close to about 95 years back. Can you imagine that many of these remedies, the provings has been done more than 80, 90 years back? It's quite amazing. When I started studying, I felt that why as homeopaths we haven't been able to study these remedies more in detail. I was quite amazed actually. And what are the main indications of pituitary gland? But before we talk about pituitary gland, I want to talk to you about there are three types of pituitary gland. What are the types? Let's learn that. The first is pituitary gland the whole, which means the remedy is prepared from the entire pituitary gland. And this is a remedy I use a lot now than let's say 10 years back, especially in endocrine disorders, especially in cases of obesity, hormonal disorders, lack of reaction, and especially in brain related diseases, neurological diseases, where the entire brain is affected. For example, stroke. If I see a case of stroke or a cerebrovascular accident, and after that the brain is not responding so well, one of the first remedies I'll give would be pituitary gland. The another remedy for the same brain related disorder is called as thalamus. We have a remedy prepared from thalamus. It's a part in the brain. But these two remedies I use a lot. The other type of pituitary gland is called as anterior pituitary. This is another of my favorite remedies. Now, this remedy, anterior pituitary, is a remedy especially for thyroid disorders, especially autoimmune thyroid disorders. If you're treating a case of thyroid disorder, whatever it is, hypothyroid, hyperthyroid, autoimmune thyroid, Graves' disease, and the well-selected indicated remedy is not helping, the important intercurrent remedy would be anterior pituitary. That's a remarkable remedy. Yeah. And then we have one more pituitary remedy. It's called as posterior pituitary. Posterior pituitary secretes, as you know, certain hormones. Anterior pituitary secretes certain hormones. So it's also, when you want to study these remedies in detail, one of the first things you want to do is study physiology, right? You want to know what exactly is secreted by what. So posterior pituitary, I found it very similar or very close to sepia. It has certain indications very close to sepia, right? Many post-pregnancy related disorders, for example. So let's come to pituitary gland. Pituitary gland is one of the most important remedy in cases of head injury. If you're treating a case of head injury, or you're treating a case of a stroke in an old man, and well-selected remedy fails, or even this old man has a lot of dizziness, vertigo, has gait-related disorders, can't walk properly. Think about this remedy, pituitary gland. Pituitary gland also has a tendency of spasmodic pathology. Anywhere where there is spasm, anywhere in the body, it has a great spasmodic kind of state. As it is related to the brain, all the symptoms where a lot of sensorium is affected, concentration difficult, confusion, congestive headaches, all these kind of patterns you would think about in pituitary. Big remedy for brain strokes. Big remedy, pituitary gland. You want to keep this remedy in your clinic. It's that kind of remedy. It's also a very good remedy if there is a hemorrhage in the brain. Now you will say, how can you say that? Well, I don't say that. I would never say that. Only one person can say that. And of course, that is our own favorite, absolute favorite gentleman, Mr. Boric, right? The great Boric. Remember, everything I'm talking, I'm going to show you exactly written in black and white. If you open Boric, let's see, Boric, what's written? It's written very nicely. The third line, cerebral hemorrhage. It's written there. Okay. Will check hemorrhage. It's written. And add absorption of clot, which means if there is a thrombus formation in the body, especially in the brain, right? If you see there is a particular thrombus formation, very nicely, you can remember pituitary. What is the first line written by Boric? This is another thing that I use a lot. Pituitary exercises a superior control over growth and development of sexual organs. Many young women, young girls, young boys come to me. In fact, they don't come to me, their parents bring them to me. And they say that the child is not developing so well. You know, the body is not developing so well. The height is not. Today, one young girl was brought by her sister. Doctor, her body is not developing, her height is not developing. Can you do something? Because there is nothing in allopathy. Well, there is something in homeopathy. It's quite fascinating that some absolutely complex, unbelievable disorders which has nothing, no treatment available in allopathy, and in homeopathy we have some absolutely fascinating remedies for them. It's just such a joy to sit and see patients every day. So for this condition also, pituitary gland you want to remember. Finally, the forgotten thing that I want to tell you is, especially I give pituitary gland to many mothers or to be mothers. So if you know someone who is about to deliver or is, let's say, into the fourth, fifth, sixth, seventh month of pregnancy, I make a small medicine kit and give them. And in that, there are remedies like Colophyllum, pulsatilla, semicifuga. But a very important remedy I always keep is pituitary gland. Why? Pituitary gland, especially very important uterine inertia, especially where the os is fully dilated. Boric writes. So, so in cases where the mother is unable to, is not able to get the pains, like opium, there is a lack of reaction. She wants the pains are not coming. Think about pituitary gland. So this is very important. Or young boys or girl, and their secondary sexual characteristics is not developing. Think about pituitary gland. So this is what Boric writes, all these indications. One of the best potency to use it, of course, is in 30 potency, Boric writes. And I began my journey of using pituitary gland with 30 potency. Of course, now I even use it in 1M, but of course, I will talk to you about it. But when you start, it's a good idea to begin your journey with 30 potency. So let's go back to the case. Let's see what happened. Let's go back. and we'll come back. I was talking to you about this particular case. Yeah. So what happened after pituitary gland? Let's have a look. So after giving pituitary gland, you can see initially there was no response, and after pituitary gland, first time we saw some response. We saw some response for the first time in his case. And then we had to study his case again. So that's what we did. I started studying his symptoms. So pituitary gland, what it did, what these sarcode remedies often do is they stimulate the case to open up the case, to open up certain symptoms. So that's when I saw that his response improved. He was able to come out of the ICCU. The Glasgow Coma Scale improved, etc. And then I studied his deeper remedy, that is his state, a remedy for his state. So you understand what we are doing. The pituitary gland or many of these sarcodes would often stimulate that particular area in the case, that particular organ, that particular system which is blocked, which is need to be stimulated. And then once it's stimulated, it will open up with certain array of symptoms, and then you can give the deeper indicated remedy, right? Whichever that indicated deep remedy is. Now, in this particular case, I'm going to summarize the case for you in short. I started studying his case, and one of the few things that the daughter tells us about him is that he's a kind of person who's a very strong personality and big boaster, always talking very highly about himself. Oh, I will do this, I will do that. So this is what is called as anamnesis, which means that you try to understand the person's state from the beginning. So he's a kind of person who's, never scared of anything, and a kind of person who talks a lot, boasts a lot. I'm this, I'm that. Not scared ever of anything, very friendly, will go out of the way to help people, very sociable, very concerned about how he will be perceived outside, how his image is outside. As a young man, he was a big bodybuilder and a kind of personality who could do anything. This is what he would talk about himself. You don't know who I am, what all things I can do, that kind of personality. So I studied his case, and when I studied his case in detail, I of course found a very beautiful remedy for him. And of course, that was the fungi remedy, the great fungi remedy, the great Agaricus muscaris, which has some very interesting patterns in the case. One of the interesting pattern is egotism, overestimation of himself, and egotism reciting their exploits. This is a very typical pattern of Agaricus. Another very important is sociability, like phosphorus or lachesis, and social position concerned about, like we read from album. So just summarizing this case. So that's what I gave. Afterwards I gave him Agaricus, and you know that Agaricus has a very specific action, as Phatak writes, has a very specific action on the cerebrospinal axis. Very important remedy on the brain. Many of these fungi remedies, like Agaricus, like sickle cord, like there's a very interesting remedy, psilocybe, from fungi group of remedies. Very good action on the brain. That's what I gave. And let's see what happened after that. It's a remedy I use a lot, okay, Agaricus, in my clinical practice. And he improved very nicely. He was able to come out of the situation.
Right.
He came back home very quickly. In fact, he came to my clinic.
पूर्ण गच्च बंद. आता तोंडामध्ये गॅस वर असं पाणी गॅस
He beautifully improved. from the situation where this particular person was in coma, how step by step we got him with homeopathy to come out of it. It's quite miraculous. So this was my first experience actually with the remedy pituitary. Before this, I never thought about pituitary. And after that, I've been using a lot of sarcodes. This is another case. This is a case of a 30-year-old lady with a lot of anxiety and infertility. And interestingly, I had given this particular lady many remedies, including the main remedy which helped her a lot was lithium carb for her anxiety. Okay. So she, yeah,
Gaurang, is it possible to answer some question about the first case
how about doing
before
it?
you?
Yeah, I can, sure.
Are you sure?
I think it would be nice for me to answer in the end. No, we'll keep some 15-20 minutes. What do you feel?
Okay. Yeah, that's fine.
Meanwhile,
Yeah.
Tracy asked, what potency was given? Hello, Tracy. We gave 1M. We gave 1M agaricus. And later on, he was on LM potency.
Okay,
LM.
then we do the
LM
rest of the
48.
questions
Yes,
at the end.
I think it would be nice.
Yes. Okay.
Only a very, very important question that you want me to talk in between, I will do that. Okay.
Okay. Yeah.
All right. So let's come back. So this is another case. This is a case of anxiety and infertility in a 30-year-old lady. And many remedies were given in the past. My focus here is not to talk to you about why I gave agaricus or why I gave lithium carb, but here my idea is in today's talk is to focus more about what is the main approach of using these sarcodes and give you a broader picture about these remedies. Okay. So many remedies were given, and lithium carb was one of the main ones that was given, and that was helping her in the past. But now there was a problem. Her, estrogen and her hormones were not. She was not able to conceive. She also had polycystic ovarian disease. Someone asked what to do in polycystic ovarian disease. So this is a case for you to see. So what was the problem? She was putting on a lot of weight. She was gaining weight a lot, and her she had certain menstrual issues. And when she met the gynecologist, they suggested to do IVF and some more hormonal procedures, etc. We wanted to treat with homeopathy. She was not responding to anything at all. So when we studied her case, one of the main things I found about her was that her main pattern was very childlike. Her main symptom was she was very, very childlike. Like a 30-year-old lady, but she was behaving like a 12-year-old girl. Okay, so she was very, very childlike. Smallest thing would make her very, very angry. She would behave very, very differently. She would start crying on the smallest thing. She would get angry on the smallest thing. If there is smallest situation at home, if things are not kept properly, if the paper is in a wrong place, she would get very, very nervous, very, very anxious. She will call up her husband and say, "Oh, doctor, oh, today this happened, can you do something?" And she will start crying. And then she'll be a little okay after expressing her emotions. So this was her one of her main thing. Very obsessed about cleanliness, extremely fastidious. Many symptoms related to the menses, right? before, during menses, she would cry a lot. She would get a lot of backache, a lot of abdominal pain. But she had a OCD about cleanliness. Everything has to be organized very well. Very, very restless. Always wants to keep herself busy, cleaning, doing things. Always wanting to be extremely busy. Can't sit idle at all. Likes shopping a lot. Always wanting to go out, keep doing something. And her another worry was she couldn't imagine her life without her husband. She couldn't imagine her life without her mother or father. So her biggest fear was, what will happen if they die? My God, even thinking about this, I would be so scared. What will happen? What will happen? So there was this strong state of fear of losing her family members. So I studied her case in detail. And for me, when I studied a case, and I want to share this with you, how I study these kind of cases, hormonal cases, was that she had taken a lot of remedies, she had taken a lot of hormones, so it was a kind of a blocked case. So I had to plan a strategy for her, a remedy to remove the block, followed by the deeper indicated remedy. So this is the approach. I want to just explain you the approach that I often do. I would give a remedy to open the block. Now that could be a sarcode, a nosode, bowel nosode, could be any such kind of a remedy. And after a few days, give the deeper indicated remedy. This is often a strategy that I use in some cases. Remember, this is not something you will do in all the cases. This is something you will do in your failure cases. Like in this case, we are treating her for 8-9 months without any change. Now you want to think out of box. So what is the deeper indicated remedy for me when I studied the case? When I started studying the case, I found for her the remedy. Of course, you know the remedy, the graphitis. Graphitis, as you know, is a carbon remedy. And when you study graphitis from the periodic table, let's have a look. You can see that it comes into the row 2. And all the remedies belonging to row 2, as you already know, have a lot of childish kind of patterns in them, as if someone who's totally dependent on their mother-like figure, on womb, as they say. And of course, graphitis is a huge remedy for polycystic ovarian disease. It causes ovarian cysts. It's very important for infertility. Irresolution about trifles. And I think you know this famous symptom of graphitis also, that, let me read this for you. Graphitis, Allen's keynote. Graphitis suited to women inclined to obesity, habitual constipation with a history of delayed menses. And then it's right. What pulsatilla is at puberty, graphitis is at climacteric. It's quite interesting. If you feel someone is pulsatilla as a child, much later in their life, that patient may require graphitis. The great Allen already spoke about this many years back. It's quite fascinating that everything that we talk about has been already said by our great masters many years back. So sometimes one of the things I often say is just stick to what our classical masters have said. They have said it all, right? But I didn't only give her graphitis. So what did I do? I want to show you my prescription. Yeah. So what did I do in this case? I gave pituitary gland. This is a very interesting prescription. I gave pituitary gland 30 2 times a day. for 5 days, followed by pituitary gland 200, 2 times a day for 5 days, wait for 1 week. And then I gave graphitis 30, 200, 1M, followed by LM2. So this is an entire strategy. You might feel that, my God, so many things, so many remedies. So this entire approach, I want to just tell you a little bit more about this. Many of the things that I do, I also use a lot of Master Burnett's method, right? I think you know about Burnett's method, the great Compton Burnett, and he used a lot of ladder of remedies. This is one of the concepts he often used in his clinical practice. Okay. Someone seems in a mood to do some painting today, but doesn't matter. I like modern art. So let's come back. So one of the concepts I often use is Burnett's method or ladder of remedies, which means that in certain cases you have to create a strategy of giving step by step certain remedies. This is something that Burnett often did. And the other thing which is also worth remembering is what you're seeing here, like 3201M, right? The potency you can see. This is something that I learned from the great M.L. Tyler. And she would call this as ascending potencies. What is this? What is this ascending potency? It's step by step increasing of the potency to stimulate that particular organ. So this is something that Margaret Tyler spoke about, and I use a lot of this approach also in challenging cases, not in all the cases. That's what I did. So this is the prescription, and I repeated this. I continued this particular thing twice or thrice in the next 6 months. And well, there was a very good response to this. And within the next 2 months, actually, her urine test, pregnancy test was positive. She did very well. And throughout the pregnancy, everything was okay. She had certain minor health issues, including a lot of nausea during pregnancy, where I used the remedy thyroidinum, which I use a lot for morning sickness or uh, nausea during pregnancy, and the child and the mother are in a good health after giving this. And very interesting. So someone was asking me, what about pituitary gland on Yeah, so pituitary gland is extremely important, as I mentioned, for a lot of sexual development, right? Pituitary gland is extremely important for polycystic ovarian disease, for hormonal diseases. So if you're treating a case of a woman where you have already given all the sarcodes like folliculinum, uforinum, you have tried everything, sepia, pulsatilla, hundreds of remedies. I don't know. And there is still a lot of irregular menses. And this is something that is from puberty onwards. There's a lot of delayed puberty. There is also a lot of obesity. And also, along with all of this, you also see that there's a little dwarfishness. What is dwarfishness? Dwarfishness means the body and mind is very, not so well developed. Another rubric is development arrested. That the hormones haven't developed so well, the body hasn't developed so well, the mind hasn't developed so well. When you put this together, this is a very key pattern of pituitary gland. Let's see this in the repertory. Everything that I say is connected in classical homeopathy. Let's have a look. So when you open the rubric, let's have a look here, please. When you have a look at this rubric, development arrested, and you can see very nicely one of the remedies out of the 100 remedies, one of the big remedies, pituitary gland. I hope you can see my repertory. Yes. So this is one of the very important rubric that I often check out, pituitary gland, in this rubric, development arrested. And this is also one of the ways where I use in children, a lot of cases of children, autism, developmental delay, even very low immune system. I use a lot of pituitary gland. So let's see one more case, okay? I'm going a little fast. Please pardon me, but the idea today is to give you little different glimpses of some part of my work and some interesting clinical experiences, because it's important for me today, as I've discussed with Judith and Dorothy about the clinical work with these kind of forgotten but lesser known, very, very gem of remedies that we have in our classical homeopathy. So this is a case, I was again struggling in this case. It's a case of a recurrent cough and cold, very weak immune system. Okay. And many remedies had been given by many homeopaths. Even I had initially given the child basilinum without much change and many indications. And I was really struggling in this case. I just didn't know what to do. Okay. What to do? We have many cases like that. Recurrent cough and cold, the immune system, every 2 months, weather change, and he has cough, cold, all this kind of thing. A lot of colic in the abdomen, digestion is an issue. So I studied his case and I really failed for a few months. So this is when I thought that I need to really understand in many children's cases where you don't find a good remedy. One of the best things to do is to study the mother's state during pregnancy, right? How the mother's health was when the child was in the womb would be so crucial, would be so important. That's what I did. I started studying the state of mother during the pregnancy. And when I started studying, I was able to understand so many things. So, one of the first things we came to know about was that the mother had a lot of abuse, a lot of physical and mental abuse by her husband and her husband's parents. And they would traumatize her, abuse her, treat her like a victim. And the husband would drink alcohol and physically hit her. And it was a very, very difficult situation. Unfortunately, she got married to him, and she also had a fight with her parents. So she says she felt trapped, she felt suffocated, but she couldn't do anything because she had to bear the suffering keeping quiet. It was a very, very difficult time for her. And even with all of this, she felt very harassed, very, very persecuted. And she wanted to get out of this, but she couldn't because she had a child in her womb. And this was the main pattern, of feeling of a victim, of feeling of a lot of sadness, a lot of grief, and wanting to take care of the child who's in the womb, wanting to sacrifice herself for the child. This was her main state. And in all of this, she she wanted to talk to someone that would make her feel better. And she was very sensitive to milk. And she had a lot of problems previously, before and after the menses. Interestingly, she would also describe a lot of dreams with bulls and cows running behind to attack her. Was a very, very crucial part of her dream. She would feel scared. She would feel they are attacking her. They will come anytime and attack her. And it was she actually felt very, very scared, frightened. She she felt very guilty in this whole situation of her marriage, and she felt she has done wrong, but she had to go through all this. So it was a very interesting prescription for me. So I gave her, the first remedy I gave her was, after the review, was the great remedy, the lac defloratum. It's a remarkable remedy. I use this remedy a lot in clinical practice, lac defloratum. Lac defloratum, you can think about it a little bit similar to pulsatilla in animal kingdom. If you're thinking of pulsatilla in plant kingdom and you want to find a animal kind of a close relative of pulsatilla, you want to think about lac defloratum. Lac defloratum, and there have been a lot of provings of lac defloratum also. It's a remedy prepared from skim milk. One of the key symptoms is this history of lot of abuse, and they want to talk to someone. Talking to someone makes them feel better. In fact, the right symptom is, I'm going to just show you from Fatak Materia Medica, what is the exact symptom of lac defloratum. Let's have a look. Better by conversation. I hope you can see my Materia Medica screen. Yes. Better by conversation. What is meaning of conversation? It's very important to know. What is the meaning of conversation? Let's do this. It's very important to know the meaning of every word. In if you want to understand homeopathy more, I'm going to see if I have a. Okay. I will open. Let's see. Yes. Can you see this dictionary that I've opened? You can see, yes. So you can see here, conversation. Conversation comes from the word converse, right? And now I'm making you how I wrote my first book, Decoding Mental Rubrics, where I try to understand every rubric, what it means in the deepest way. So conversation comes from the word converse and actually comes from a very old French word converse, which is which origin is con means with and verse means to turn. You know, vertigo, turning. Con plus versaire. Now, why I'm talking about this? So actually, to understand the meaning of conversation is to talk with someone round and round, round and round, round and round without any result, without any dialogue, without any conclusion, but just do round and round. You know, sometimes we just talk to someone not actually talking, just something, just over the tea. You know, this we do a lot in India. We just have tea and we just chit chat. Oh, you know, this happened today, and okay. This is very typical for lac defloratum. Lac defloratum feels better after just talking round and round, round and round without coming forward with any topic. This is the symptom of lac defloratum. Homeopathy is quite deep, huh? You have to study a lot. But if you do it with a lot of joy and enjoyment and, you know, just enjoy the path while doing it, it's a lot of fun. And then one life is not enough when you do that. Okay. So let's come back. So lac defloratum, forsaken feeling. There's a lot of guilt also in lac defloratum. Dreams of being attacked and so on. So that's what I gave. I gave lac defloratum, and unfortunately with lac defloratum, initially there wasn't much change. So that is when I clearly knew that he required an intercurrent remedy. And that's when I gave the intercurrent remedy, the pituitary gland 200, followed by lac defloratum. And after this, after this, remarkably, the child's immune system improved, his overall health improved, his cough and cold, his body developed so well. And it's been more than a year now. It's been the best year for him for the last entire of his life. His abdomen pain has disappeared. His height has improved. I'm not going to show his pictures because of confidentiality issues, but his height has improved. And in fact, he was very, very timid previously. That has improved, and he has done very, very well. Actually, I'm quite happy with his huge progress. So this is a little bit about pituitary, and I use a lot of pituitary, even in autistic cases. I use a lot of pituitary gland. I don't know how much time we have more. Judith, we have 30 minutes more.
I don't know how much energy you have left.
How much time? Yeah. I'm wondering how much time we have more. 30 minutes?
Yes, maximum.
And you want to keep a maximum? Okay.
Yeah.
Okay. So you want to keep about 15 minutes for question answers in the end?
Sure.
Is that a good idea? Because we promise our friends some important questions, right?
Mhm.
Okay. So I will shorten my talk a little bit. So I was telling also in so many cases of autism spectrum. This is another case of autism spectrum who had mild autism with ADHD with delayed development. Just not improving for a long time. We gave him, it was a, we gave him pituitary gland 30 after 2 weeks carcinosinum. And again, a remarkable change in this case also. Case after case, we have cases of thyroid where we give pituitary. So we will of course talk about this so much in detail in our, as Judith said, in our seminar that you could join online in on November 14 and 15, right, Judith? That is the, so it's, you can all join there. We also did something very interesting. I wanted to just share with you this today. So what I also did was, with help of my colleagues in the clinic, I asked, could you find for me, especially in the last like so many years, especially in the last 2 years, can you tell me how many times I've used pituitary gland? And they told me in the last 2 years, I have used pituitary gland in close to 30 cases. I've used them as intercurrent remedy. So in last 2 years, 23, 24, not this year, I used pituitary gland in close to 30 cases. What happened in those cases? So I did a small kind of a clinical uh, experience, and we found that we gave it more often in male patients than female, some data, and much more common in young children between the age of 0 to 18. Pituitary gland was more often prescribed in our practice. A large number of cases, out of the cases, a large number were developmental disorders. I also had some pituitary macroadenoma where I used pituitary gland, polycystic ovarian disease, diabetes, thyroid. I used a lot of them. More often, I use pituitary gland as an intercurrent remedy compared to first remedy. So very often I'm giving a remedy, it's not helping, and I'm just given one dose of pituitary gland and then the indicated remedy. This was more often than it being the first remedy. Most of the cases I gave 30 potency. So 30C was the best potency of all the results. And close to about 74% did fairly well with after giving pituitary gland out of 100. And 14 of those cases had a remarkable change. The common developmental disorders was Down syndrome, ADHD, cerebral palsy, PCOD, infertility. Pituitary macroadenoma was common in the cases where I give pituitary. So yeah. So what did we see in all the cases? What was the main theme? Let's see that. More often they were either developmental delay, either hormonal disorder or brain related disorders. Many of the cases were dwarfish. That means their height was very less and they had pot belly and very hypotonic muscles. We also found that many of the cases where we gave pituitary gland, the patients were very emotional, very sensitive, very attached to their parents, and extremely restless in most of the cases. And in most of the cases, we also found that calcarea was the next remedy after pituitary that helped. So these are very interesting studies that we try to conduct in our clinic through our patients. So this is an interesting experience that I want to share with you for which is worth kind of remembering also. And as Judith has already shared that we are going to study not just sarcodes, but even nosodes, even lesser known nosodes. I thought I will share with you one case of nosode before we call it a day. So this is a case of a non-healing ulcer after a road traffic injury in a 57-year-old male. And he had a very bad ulcer. Let's have a look at his ulcer. Very bad non-healing ulcer, which was not improving. It was referred to me by my colleague in South America. And I remember this case very nicely because I remember doing it at late night. Similar time like what we are right now for me. It was 11:30 at night. And the colleague called me up. This was during COVID that I have a patient, he's in a lot of suffering. Can you do something? And I don't know, due to some reason, I was not getting sleep. I said, okay, let's do it. So I just opened the call. This was 4-5 years back. Okay. So I opened the Zoom and we did the case. And I just asked one question. Tell me what's happening. And after that, for 1.5 hours, I didn't have to ask any question because he kept on talking. He kept on talking. And it was 1 o'clock, it for me afterwards. And I was like this, oh God. And he kept on talking. The only thing he spoke about was sex, was women, was about himself, and was about snakes. That's it. He kept talking about it. There was nothing else. And it was strange, he was talking about how a great womanizer he was, and he had his wife sitting with him. And, it was a strange kind of a case because he's talking about other women and his wife is sitting next to him like this and looking at him. And it was, well, an experience. So I studied his case. And of course, I wanted to give him lachesis, but he had already taken all the snake remedies. So what to do? But you could see this pus, huh? Can you see this pus in the ulcer and everything? Very painful. So what to do? What to do in cases where there is a lack of reaction? Very often you want to give a broad spectrum remedy to open the block. which is the biggest broad spectrum homeopathic antibiotic? And of course, I wanted to give him lachesis. Lachesis is the most loquacious homeopathic remedy, you know this. But in complicated cases, you need a different approach. And that's why the use of a nosode and a nosode followed by the deeper remedy. So what did I give? I gave staphylococcinum, which is a huge, the biggest, the broadest homeopathic antibiotic nosode. I gave it 200, 2 times a day for 3 days, wait for 2 days, and then lachesis 200. And very nicely, his ulcers started improving in the next few weeks. You can see here. And gradually, the granulation tissue started coming. And remember that this particular gentleman was taking many, many snake remedies for the last close to 6-8 months. And after staphylococcinum, the case opened up, This is the important part, I want to tell you. And just in 1 month of staphylococcinum, then lachesis, you can see the skin beautifully healed. And you can see here step by step how beautifully the pituitary gland and lachesis showed a very beautiful healing. This can happen with homeopathy. Quite fascinating. People ask me what was the potency given. Here it is. You can have a look. Staphylococcinum 200. So, well, we are going to also talk a lot about staphylococcinum. It's a remedy I use a lot in my practice. Mainly, the main indication is, of course, abscess, infection, but there is a mental theme of staphylococcinum, and that is of feeling of a lot of trapped feeling and victimized feeling. There's a lot of sexuality in staphylococcinum also, and there's a lot of pattern of sexuality. In fact, in the provings, there were dreams that she was a man. There were dreams of insects, dreams of her own death, feeling as if they are from opposite sex. This was one of the patterns that came in staphylococcinum proving. The other important theme that came up was over-adrenalized, too much excited. And you can see in our patient, he was too much excited about sexuality, talking about sex, thinking about sex. So people who require staphylococcinum this came in the proving from Riley in 1995, close to 30 years back. There was a lot of over sexuality, over excitement and things like that. And there's a lot of laughing and smiling, and there's a nice rubric, very high-spirited kind of personality, There's a nice thing in the proving, nervy, hyper, shaky, as if from a caffeine buzz. A lot of people in today's time require staphylococcinum. And also the other pattern about staphylococcinum that came up in the proving also was the pattern of the need for competition, the need for looking for opportunities and taking advantage of these opportunities, and then feeling overwhelmed and burnout. So I want opportunity, I want opportunity, I want to do something, I want to do something. And when you get it, you take too much, and then you, it's too much. A little bit like the bacterial pattern. There's a lot to study in all of this, and it's just so fascinating to know these remedies and to put them into clinical experience. I tried to summarize some interesting experiences in today's talk for you. I hope it was interesting for you. I may have gone a little faster today because of limited time. If you want to share your experience or something, you're welcome to write to me. Or if you want to know something more about my work, you can write to me, gaurang@gmail.com. And I am excited to meet all of you in Netherlands. And I'm going to ask Judith to once again tell us a little bit about the plan for the Netherlands seminar and how she wants to invite all of you there, and maybe after that we can take some question and answer. Judith, please share something about our November seminar for our friends to know about what it is all about, because there are a lot of people who want to join online the seminar.
Yes. Well, it's taking place November of this year, 14th and 15th November. You can visit us in the Netherlands, which would be nice, of course, but it's also possible to join us online. You can register on our website. Please feel free to email us if you're having trouble with registration. We're happy to help. Yeah, so lots of interesting subjects will be discussed. Histoninum also, cortisone, folliculinum, baxillinum. Yeah. So much more of what we've heard tonight, much more in depth, and of course, the possibility to meet Dr. Gaurang Gaikwad in person. Gaurang, do you want me to read the questions?
Yeah, let's go over some questions, some interesting questions. We'll go over them together.
Let me see. I have summarized a bit for you, hopefully.
Sure. Yes.
About the first case, the man with in coma. A very
Sure.
practical question. How do you give him a remedy if he has a ventilator covering the mouth? And will the
Good question.
hospital let you take this ventilator off?
Yes. So many this good question. So of course, all the answers are written by Master Hahnemann in Organon of Medicine. So he has mentioned different ways of prescribing, and one of the ways is olfaction, and another way is what we do in many patients who are admitted in the hospital is kind of taking the medicine and rubbing it on the wrist and on the ankle, because the nerves there are very sensitive, and that's the best way to absorb. So we are very lucky in Mumbai, in many hospitals, in some parts of India, the allopathic doctors, the hospital, they allow to take homeopathy along with allopathic medicine. In some cases where they feel allopathy can't do anything, they say, okay, do what you want. So we get an opportunity to treat in an integrated way, and I think that's a great blessing for us. As you know, I always say that, of course, I am very blessed. I'm very grateful that I get to treat patients in India and also all over the world. So I get to see both parts of the world, but especially in India, because we get such a great opportunity to treat cases which we wouldn't get anywhere else in the world. So just we are blessed and we are lucky.
Yeah, wonderful. And also about the same case, and maybe also a bit more in general, can you say something about the potency and repetition of the potency?
Well, sure. So perhaps I've written a small article about potency and how to use potencies and how to repeat. Especially in Nosop Sarkod, I will share this particular article with Judith, and maybe she can put it on her website or in the or share it with the participants at some point. So in general, potency and repetition is a very, very kind of a debatable topic. But remember that the idea is very similar, that, for example, pituitary gland is a remedy that I use a lot in 30 potency. On the other hand, insulinum is a remedy I use a lot in 6 potency, right? Pepsinum, another sarcode I use a lot in 6 potency. On the other hand, thyroidinum I use in all potency. I use in 6 also, I use in 10M also. How do we know that? So when the symptoms are lesser and there is a more pathological case, there are fewer peculiar symptoms, you give low potency. If there is a more clear state, and lack of reaction, you give a higher potency. This is generally the idea. The lower potency has more frequent repetition, higher potency has infrequent repetition. So this is a broader idea. But of course, there are so many things here, because I use all potency. I use even mother tincture. I use CM potency. I use LM. I use tissue salts. I use back flow. I use everything depending upon the type of case and what I want to do. So I think one should have the entire armamentarium of all the approaches available with us to help our patients.
Yes, thank you. Okay, then I have different, all kinds of questions.
Okay, all kinds.
All kinds of questions. Do you
Okay.
have experience using amygdala gland sarcode? Amygdala.
Say again.
Do you have experience in using the amygdala? I don't know how to mention it.
Amygdala. No,
Amygdala.
I
Yeah,
haven't used it. No.
haven't. No, okay. Can you kindly share your experience with thalamus?
Say again. With
Your experience with thalamus. Thalamus.
thalamus.
Thalamus.
I'm getting used to the accent. So thalamus, so one of the best places where I started using thalamus initially is in neurological cases, like cases of motor neuron disease, cases of Parkinsonism. A lot of neurological cases you want to think about thalamus. Julian has written a very nice materia medica about this. Close to 50 years back, he has done a entire proving of this. As you know, thalamus is a important nuclei in the encephalon, and it's a remedy, if you want to understand, has a lot of catatonic and paralytic state. You can see here. So has a lot of paralytic state, neuralgic state, spasmodic states, and one of the only remedy Julian writes in Parkinsonism. So when you're treating a case of Parkinsonism diseases, when you're treating a case with a lot of neurological symptoms, formication, paresthesia, numbness, spasms, and there isn't enough result, I often may think about thalamus uh, as a remedy. Very nice materia medica. Julian has written and described in detail.
Okay. Even kijken. Let me see. Delayed second dentition. What to give? Dentition. Delayed second dentition.
Well, the indicated remedy could be a best remedy. But if you're thinking about delayed development in general, then you have to think about all the sarcodes, including pituitary, including thyroidinum. There are a couple of other sarcodes which we use a lot, including DNA, RNA, deoxyribonucleic acid, and ribonucleic acid. Of course, I didn't have enough time today to talk so much about 20 or 25 sarcodes, but I'm going to attempt to talk a lot about a lot of lesser known sarcodes and so many experiences in November in AVKH school in Zool. So yeah, we will discuss about it hopefully.
Okay. What about pituitary gland in congenital adrenal hyperplasia?
I haven't used it in congenital adrenal hyperplasia, but you can also study remedies prepared from adrenal gland, like adrenal cortex, adrenaline, cortisone, ACTH. I recommend you to study them. Okay. I hope it helps.
And what about anxiety, panic cases? What's the role of pituitary gland in these?
I haven't used it in panic states, but I do assume that in future a lot of these remedies, the sarcode remedies like histamine, cortisone, will be very important in psychiatric disorders also. I have some interesting psychiatric cases where I've used the remedy thyroid in them. So I do believe that the future of a lot of homeopathic advancements could be in sarcodes.
Then also two questions about vitiligo.
Vitiligo.
And yeah, any intercurrent remedy for vitiligo?
Yes, I use. So I'm trying to create this. Let me try to see if I can show you something that I'm trying to create. You know that as a homeopath, it's very important to be a little crazy. A little crazy, not too crazy, because then it's a problem. But yeah, with me, everything is a problem. So this is something I'm trying to create for the last months. It's called as a repertory of intercurrent remedies. I hope you can see my working thing. So I'm trying to create, like, for example, if you're treating a case of abscess, which is important intercurrent remedy, I've written here staphylococcinum, gunpowder, hyposanium, right? Or if you're treating, let's say, a case of tonsillitis, what could be an intercurrent remedy? Streptococcinum, I've written here. So I'm trying to create this kind of repertory. For example, you can see alopecia, a lot of hair fall. Which are the intercurrent remedies? Thallium metallicum, nosodes, pituitary gland. I've written pituitary gland also in alopecia. So some quite amazing remedies. Coming back to your question about vitiligo, there was a great homeopath from India. He had the best results in vitiligo. I don't think anyone else uh, had vitiligo results as good as the great Dr. Sarabhai Kapadia. Was a great homeopath, okay? This particular gentleman, Sarabhai Kapadia. And he has written a book called as Homeopathic Reminiscences. It's a very, very old book. Maybe it's not available anywhere, but many years back, I collected it. And he has shared many, many cases of vitiligo. And he found nosodes as the main remedy. Now, how to choose the nosode? That should be based on studying the miasmatic patterns. So he has shared many cases where he has given syphilinum 10 just one dose and waited for many months. And he has shown cases with more than 3-4 years of follow-up. So I would definitely consider nosodes and studying anti-miasmatic in vitiligo. The two important intercurrent remedies that I often use is Soralia. In local application also I use in vitiligo. Yeah. And of course, another is Ami Vish Naga. You want to read about this from the Materia Medica. It should be a combination when you're studying homeopathy of old classical homeopathy, but also don't forget a lot of latest clinical experience and latest advancements that you should be up to date. This is something we can learn from our modern medicine in allopathy. Every year, every 6 months, every few years, they have certain kind of get-togethers and they are sharing the latest advancements with each other. And I feel that in homeopathy, we need to do that more often with colleagues. And I feel that this kind of get-togethers are very important so that we get to learn from each other.
Mhm. Okay, I think I have one last comment, and that was from Dr. Riasat. I hope I pronounced this well. Dr. Riasat.
Okay.
He made me very curious because he was asking a few times about the treatment of a person who had a temperature, fever 2 years ago, and the legs were not working. Have you got any clue what he means? Or maybe you can unmute yourself, Dr. Riasat. I'm not hearing anything.
Perhaps they can email us if that's a necessity,
Mhm.
right?
Yeah. Okay, then I would say, unless you have something to add, that it would be good to wrap up from here.
Yes, it'll be great to wrap up. Thank you, everyone, and thank you to our entire homeopathic community in AVKH, and I'm looking forward to meet some of you, if not all of you, in Netherlands, and it'll be a pleasure to meet all of you. And hopefully, many of you can join online also. And
Thank you,
if,
sir. Sir,
yeah.
sorry for the disturbance. One question, sir. What do you think about Berkeley Square, sir?
I don't think about anything about Berkeley Square as such, but I'll have to read up about this particular. I think you're talking about a literature that they have written, right?
A repertory of no sorts and
Yeah,
sir.
yeah. I haven't used it, Dr. Srinivasan. I haven't used it in that way. I've gone through it, but I found it a little different to what I'm doing and what I'm collected from the last few years. But it's of course interesting. We have to learn from everywhere, Dr. Srinivasan.
Thank you, sir. And one more, I couldn't find to get your book from your website, sir. I didn't get any response to. Would like
Right.
to buy your Noses and Sarkot's book, please, sir.
Just write an email to me, please. Okay.
Sure,
My
thank you.
website is reworking. We are reshaping the website with our team. I hope we do that, but you can write to me. Okay. Thank you. Thank you.
Then may I share something? Only one word.
Yeah.
Hello.
Yeah. Go ahead.
May I allow? Yes, please. Please, the word is not graphitis. It is graphites. This is
Graphite.
not
Okay.
to taunt any. Thank you, sir. Thank you. Thank you.
Okay. Well, thank you, Gaurang, for sharing your rich and lively experience with us. So, yeah, looking forward to meet you in person. And for now, I'm wishing you a good night's sleep. And everyone, thank you all for your presence.
Thank you, everyone. Thank you.
Goodbye.
Thank you.